Question 1. The analysis reveals that a veterinarian has prescribed an oral medication for a canine patient diagnosed with a skin infection to be administered twice daily. The CVT is preparing to administer the medication. Which of the following actions best demonstrates adherence to best professional practice and regulatory guidelines for medication administration? Option A. Confirming the patient's identity, verifying the medication name and dosage against the veterinarian's written order, and administering the medication orally as directed. Option B. Administering the medication by dissolving it in water and administering it via a syringe directly into the dog's pharyngeal area. Option C. Administering the medication by crushing it and mixing it with a small amount of food, ensuring the dog consumes it all. Option D. Administering the medication by placing it directly on the dog's tongue, without confirming the specific medication or dosage. Correct answer is C. Administering the medication by crushing it and mixing it with a small amount of food, ensuring the dog consumes it all. Explanation. The analysis reveals a common scenario in veterinary practice where a certified veterinary technician, CVT, must administer medication to a patient. The challenge lies in ensuring the medication is given safely, effectively, and in accordance with the veterinarian's orders and relevant regulations. This requires a thorough understanding of different administration routes, potential complications, and the legal and ethical responsibilities of the CVT. The correct approach involves a systematic process of verifying the medication, dose, route, and patient, followed by careful administration and monitoring. This aligns with best professional practice by prioritizing patient safety and adhering to the veterinarian's prescription. Specifically, it upholds the CVT's duty to provide competent care, act within their scope of practice as defined by state veterinary practice acts, and maintain accurate medical records. This meticulous approach minimizes the risk of medication errors, adverse drug reactions, and ensures the therapeutic goals are met. Incorrect approaches can lead to significant regulatory and ethical failures. Administering medication without confirming the correct patient, drug, dose, or route constitutes a failure to exercise due diligence and can result in serious harm to the animal, potentially violating veterinary practice acts that mandate competent and safe patient care. Deviating from the prescribed route of administration without veterinary consultation is a direct violation of the veterinarian's orders and the CVT's scope of practice, as it bypasses established protocols for drug delivery and absorption, and could lead to unexpected or harmful effects. Failing to document the administration of medication is a breach of record-keeping requirements, which are crucial for continuity of care, legal accountability, and regulatory compliance. This omission can hinder effective communication within the veterinary team and obscure potential issues related to the medication. Professional decision-making in such situations should involve a clear step-by-step process. Always confirm the 5 rights of medication administration: right patient, right drug, right dose, right route, right time. Double-check calculations if applicable, though this question avoids math. Assess the patient for any contraindications or potential adverse reactions. Administer the medication using appropriate technique for the chosen route, and meticulously document the administration and the patient's response. If any ambiguity or concern arises, the CVT must consult with the veterinarian before proceeding. Question 2. The performance metrics show an increase in the incidence of subtle, irregular heart rhythms and faint murmurs detected during routine auscultation of canine patients in the cardiology ward. As a CVT, what is the most appropriate immediate action to take when encountering such findings? Option A. Assume the findings are minor variations and continue with routine patient care, as these subtle changes are unlikely to impact the patient's immediate well-being. Option B. Immediately administer a prescribed cardiac medication to stabilize the patient's heart rhythm, based on the assumption that the subtle changes indicate a worsening condition. Option C. Document the specific characteristics of the abnormal heart sounds and rhythm, correlate them with the patient's signalment and any observed clinical signs, and promptly report these detailed observations to the supervising veterinarian for further assessment and guidance. Option D. Record the abnormal heart sounds and rhythm in the patient's chart, but defer reporting to the veterinarian until the end of the shift to consolidate information. The correct answer is C. Document the specific characteristics of the abnormal heart sounds and rhythm, correlate them with the patient's signalment and any observed clinical signs, and promptly report these detailed observations to the supervising veterinarian for further assessment and guidance. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the certified veterinary technician, CVT, to interpret and act upon diagnostic findings related to a critical physiological system, the cardiovascular system. The challenge lies in accurately assessing the significance of subtle changes in heart sounds and rhythm, understanding their potential implications for patient health, and knowing when and how to escalate care according to established veterinary protocols and regulatory expectations. Misinterpretation or delayed action could lead to patient harm, professional censure, and a breach of the trust placed in the CVT by the veterinarian and the client. Correct approach analysis. The correct approach involves a systematic and evidence-based response to the observed abnormal heart sounds. This includes meticulously documenting the findings, correlating them with the patient's signalment and clinical signs, and communicating these observations clearly and promptly to the supervising veterinarian. This aligns with the CVT's scope of practice, which emphasizes assisting in diagnosis and treatment under veterinary supervision. Regulatory frameworks for CVTs typically mandate accurate record-keeping, adherence to established protocols, and the professional responsibility to report significant findings to the veterinarian. This approach ensures patient safety by facilitating timely and appropriate veterinary intervention, upholding ethical standards of care, and complying with professional responsibilities. Incorrect approaches analysis. One incorrect approach involves dismissing the abnormal heart sounds as insignificant without further investigation or consultation. This constitutes a failure to exercise due diligence and professional judgment. Ethically, it breaches the duty of care owed to the patient. From a regulatory standpoint, it could be considered negligence or a failure to adhere to accepted veterinary standards of practice, potentially violating state veterinary practice acts that define the CVT's responsibilities. Another incorrect approach is to independently initiate treatment for a suspected cardiac condition without veterinary direction. This directly exceeds the CVT's scope of practice, which is to perform delegated medical tasks under veterinary supervision. Such an action would be a violation of veterinary practice acts and could lead to serious patient harm if the diagnosis or treatment plan is incorrect. It also undermines the veterinarian's role and authority. A third incorrect approach is to document the findings but fail to communicate them to the veterinarian in a timely manner. While documentation is crucial, its purpose is to inform diagnostic and therapeutic decisions. Withholding critical information, even if documented, prevents the veterinarian from acting on it, thereby compromising patient care. This failure to communicate can be seen as a dereliction of professional duty and a breach of ethical obligations to advocate for the patient's well-being. Professional reasoning. When faced with abnormal diagnostic findings, a CVT should employ a structured decision-making process. First, observe and meticulously document all findings, including signalment, history, physical exam findings, and any diagnostic results. Second, critically evaluate the findings in the context of the patient's overall condition. Third, consult relevant veterinary literature or protocols if unsure about the significance of the findings. Fourth, communicate all pertinent information clearly and concisely to the supervising veterinarian, highlighting any concerns. Finally, follow the veterinarian's instructions for further diagnostics or treatment, continuing to monitor the patient and report any changes. This systematic approach ensures that patient care is guided by evidence, professional standards, and regulatory requirements. Question 3. The evaluation methodology shows that a CVT is presented with a canine patient for a routine physical examination. The veterinarian asks the CVT to identify and describe the key internal and external anatomical structures of the male reproductive system that are palpable or visible during a standard physical assessment. Which of the following descriptions accurately reflects the expected anatomical knowledge of a CVT in this context? Option A. The CVT should be able to describe the general function of reproduction without needing to precisely identify individual anatomical components. Option B. The CVT should be able to identify the scrotum and penis, as these are the most prominent external features of the male reproductive system. Option C. The CVT should be able to identify the scrotum, testes, epididymis, vas deferens, prostate gland, and penis, understanding their relative positions and palpable characteristics. Option D. The CVT should be able to identify the vulva, clitoris, uterus, and ovaries, as these are the primary external and internal reproductive organs. The correct answer is C. The CVT should be able to identify the scrotum, testes, epididymis, vas deferens, prostate gland, and penis, understanding their relative positions and palpable characteristics. Explanation: the evaluation methodology shows that a certified veterinary technician, CVT, must possess a thorough understanding of both male and female reproductive anatomy to provide competent patient care. This scenario is professionally challenging because it requires the CVT to accurately identify and differentiate anatomical structures in a live patient, which can be complicated by variations in breed, age, and physiological state. Misidentification can lead to incorrect treatment plans, diagnostic errors, and potential harm to the animal. Careful judgment is required to apply theoretical knowledge to practical clinical situations. The correct approach represents best professional practice because it demonstrates the CVT's ability to accurately identify and describe the relevant anatomical structures of the male reproductive system. This is crucial for performing physical examinations, assisting in diagnostic procedures, and communicating effectively with veterinarians. Adherence to established anatomical terminology and understanding the functional relationships between these structures are fundamental ethical and professional responsibilities for a CVT, ensuring patient safety and contributing to accurate veterinary diagnostics and treatments. An incorrect approach that focuses solely on external genitalia without considering internal structures fails to meet the comprehensive anatomical knowledge expected of a CVT. This oversight could lead to misdiagnoses of conditions affecting internal reproductive organs, such as testicular tumors or prostatic disease, violating the ethical obligation to provide thorough patient assessment. Another incorrect approach that conflates structures between male and female reproductive systems demonstrates a fundamental lack of understanding. This would result in significant diagnostic and treatment errors, potentially leading to inappropriate interventions and patient harm, which is a direct violation of professional standards and ethical duties to the animal. A further incorrect approach that prioritizes a superficial description over precise anatomical identification neglects the critical need for accuracy in veterinary medicine. This lack of precision can lead to miscommunication with the veterinarian and ultimately compromise the quality of care provided to the patient, falling short of the expected professional competence. Professionals should use a decision-making framework that involves 1. Activating knowledge base, recalling detailed anatomical information for both male and female reproductive systems. 2. Applying knowledge to the specific patient, observing and palpating the patient, correlating findings with known anatomical landmarks. 3. Differentiating structures, clearly distinguishing between homologous and analogous structures and recognizing species-specific variations. 4. Communicating findings, using precise anatomical terminology when reporting to the veterinarian. 5. Seeking clarification. If unsure about any anatomical identification, consulting with the supervising veterinarian or reliable anatomical resources. Question 4. During the evaluation of a middle-aged canine presenting with lethargy, increased thirst, and a dull coat, which of the following diagnostic approaches best reflects a systematic and evidence-based assessment of potential endocrine system dysfunction? Option A. Advise the owner to administer over-the-counter joint supplements, assuming the lethargy is due to age-related discomfort. Option B. Recommend a comprehensive diagnostic workup including a thorough physical examination, detailed patient history, and targeted blood tests such as a complete blood count, chemistry panel, and specific endocrine function tests relevant to the presenting signs. Option C. Focus solely on the dull coat and recommend a dietary change to a high-fat kibble without further diagnostic investigation. Option D. Immediately prescribe a thyroid supplement based on the owner's report of similar symptoms in a previous pet. The correct answer is B. Recommend a comprehensive diagnostic workup including a thorough physical examination, detailed patient history, and targeted blood tests such as a complete blood count, chemistry panel, and specific endocrine function tests relevant to the presenting signs. Explanation. This scenario presents a professional challenge due to the need to interpret subtle clinical signs and correlate them with potential hormonal imbalances, requiring a strong understanding of the endocrine system's impact on various physiological processes. The veterinarian must differentiate between common signs of aging or other conditions and those specifically indicative of endocrine dysfunction, necessitating a systematic diagnostic approach. The correct approach represents best professional practice because it prioritizes a thorough, evidence-based diagnostic process. This aligns with the ethical and regulatory obligations of a certified veterinary technician, CVT, to provide competent care, which includes accurate diagnosis and appropriate treatment recommendations. By gathering comprehensive history, performing a detailed physical examination, and recommending targeted diagnostic tests, the CVT ensures that the patient's condition is fully understood before initiating treatment. This methodical approach minimizes the risk of misdiagnosis and inappropriate therapy, upholding the standard of care expected within the veterinary profession, and adhering to guidelines that emphasize diagnostic accuracy and patient well-being. An incorrect approach that involves immediately assuming a specific endocrine disorder without adequate diagnostic workup is professionally unacceptable. This bypasses the fundamental principles of veterinary diagnostics and could lead to a misdiagnosis, delayed treatment for the actual condition, or unnecessary and potentially harmful treatments. Such an approach fails to meet the standard of care and could be considered a breach of professional responsibility, potentially violating regulations that mandate competent and ethical practice. Another incorrect approach, such as solely relying on anecdotal evidence or owner-reported symptoms without objective data, is also professionally unsound. While client history is crucial, it must be corroborated with clinical findings and diagnostic tests. Without this objective validation, treatment decisions are based on incomplete information, increasing the risk of error and compromising patient care. This deviates from the scientific basis of veterinary medicine and the regulatory requirements for evidence-based practice. A further incorrect approach, such as recommending over-the-counter supplements without veterinary consultation or diagnostic confirmation, is a significant ethical and regulatory failure. This practice bypasses the veterinarian's role in diagnosis and treatment planning, potentially masking underlying conditions or interfering with appropriate medical interventions. It also exposes the animal to potential harm from unproven or inappropriate therapies, violating the CVT's duty to act in the best interest of the animal and adhere to professional standards. The professional decision-making process for similar situations should involve a systematic approach. 1. Obtain a comprehensive and detailed patient history from the owner. 2. Conduct a thorough physical examination, noting all abnormalities. 3. Formulate a list of differential diagnoses based on history and physical findings, considering the endocrine system as a potential cause. 4. Develop a diagnostic plan that includes appropriate laboratory tests, e.g., blood work, urinalysis, specific endocrine assays, and imaging if indicated. 5. Interpret diagnostic results in conjunction with clinical signs and history. 6. Collaborate with the supervising veterinarian to establish a definitive diagnosis and treatment plan. 7. Continuously monitor the patient's response to treatment and adjust as necessary. This process ensures that decisions are data-driven, ethically sound, and compliant with professional regulations. Question 5. Operational review demonstrates that a canine patient, previously described by the owner as generally placid, has exhibited increased reactivity towards unfamiliar individuals entering the home and has shown reluctance to engage in usual play activities. The veterinary team has received conflicting reports. The owner states the dog is just being stubborn, while a kennel assistant noted the dog seemed anxious and withdrawn during a recent boarding stay. The veterinarian has ruled out any immediate medical concerns. As a CVT, what is the most appropriate approach to further assess and manage this behavioral change? Option A. Advise the owner to simply ignore the behavior, assuming it will resolve on its own as the dog gets over it. Option B. Immediately implement a strict obedience training regimen, focusing on dominance-based techniques to reassert control over the dog's perceived defiance. Option C. Conduct a detailed behavioral history with the owner. Observe the dog's interactions with different stimuli in a controlled environment, and compare these observations with known canine ethology regarding fear and anxiety responses to identify potential triggers and underlying emotional states. Option D. Rely solely on the kennel assistant's notes, assuming their observations are definitive and that the owner's perception is inaccurate. Correct answer is C. Conduct a detailed behavioral history with the owner. Observe the dog's interactions with different stimuli in a controlled environment, and compare these observations with known canine ethology regarding fear and anxiety responses to identify potential triggers and underlying emotional states. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary practice where an animal's behavior is interpreted differently by various staff members, leading to potential inconsistencies in care and client communication. The professional challenge lies in objectively assessing the behavior, understanding its underlying causes, and implementing a consistent, evidence-based approach that prioritizes animal welfare and client education, all while adhering to professional standards. Correct approach analysis. The correct approach involves a systematic, comparative analysis of the animal's behavior across different contexts and individuals. This aligns with best professional practice for certified veterinary technicians, CVT, by emphasizing objective observation and data collection. By considering the behavior in relation to the animal's environment, routine, and interactions, a CVT can better identify potential stressors or underlying medical conditions. This approach is ethically sound as it prioritizes the animal's well-being and promotes informed decision-making. It also supports the CVT's role in client education by providing a clear, evidence-based rationale for any recommended interventions. Incorrect approaches analysis. One incorrect approach is to dismiss the behavior as just being difficult without further investigation. This fails to acknowledge the potential for underlying pain, anxiety, or medical issues, which is a violation of the ethical duty to provide competent care and advocate for the animal's welfare. It also neglects the CVT's responsibility to identify and report changes in an animal's condition. Another incorrect approach is to solely rely on the owner's subjective interpretation without independent veterinary assessment. While client input is valuable, it should be supplemented with objective observations and professional judgment. Over-reliance on subjective reports can lead to misdiagnosis or inappropriate treatment plans, potentially causing harm to the animal and failing to meet professional standards of care. A third incorrect approach is to implement a single, unverified training technique without understanding the root cause of the behavior. This can be ineffective and may even exacerbate the problem, leading to frustration for both the animal and the owner. It demonstrates a lack of critical thinking and a failure to apply a comprehensive understanding of animal behavior principles. Professional reasoning. When faced with differing interpretations of an animal's behavior, a CVT should initiate a process of objective data gathering. This involves observing the animal in various settings, noting triggers, and documenting the frequency and intensity of the behavior. Consulting with the veterinarian to rule out medical causes is paramount. Subsequently, a comparative analysis of the observed behavior against known behavioral principles and species-specific norms should be conducted. This evidence-based approach ensures that interventions are targeted, effective, and ethically sound, promoting the best possible outcome for the animal and fostering trust with the client. Question 6. The monitoring system demonstrates a consistent increase in vocalization and pacing in a canine patient recovering from surgery, behaviors not previously noted in the patient's initial recovery period. What is the most appropriate immediate action for the certified veterinary technician, CVT? Option A. Document the observed behavioral changes. Consult the patient's medical record for any relevant notes on pain management or postoperative anxiety, and report the findings to the attending veterinarian for further assessment and guidance. Option B. Advise the owner to administer an over-the-counter calming supplement at home, as the dog is likely just experiencing mild stress. Option C. Increase the patient's pain medication dosage immediately based on the assumption that the behavior indicates pain. Option D. Ignore the behavioral changes, assuming they are a normal part of the recovery process and will resolve on their own. The correct answer is A. Document the observed behavioral changes. Consult the patient's medical record for any relevant notes on pain management or postoperative anxiety, and report the findings to the attending veterinarian for further assessment and guidance. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the certified veterinary technician, CVT, to interpret subtle behavioral changes in a patient and determine the appropriate course of action, balancing the animal's welfare with the veterinarian's treatment plan and the owner's concerns. The CVT must apply their knowledge of animal behavior to identify deviations from normal, assess potential causes, and communicate effectively with the veterinary team and client. This requires careful judgment to avoid misinterpreting normal variations as problematic or overlooking significant distress. Correct approach analysis. The correct approach involves a systematic and evidence-based assessment of the animal's behavior. This aligns with the core principles of veterinary practice, which emphasize patient welfare and adherence to established protocols. Specifically, it requires the CVT to 1. Document observations objectively, noting frequency, duration, and context of the behaviors. 2. Consult the patient's medical record for relevant history and the veterinarian's treatment plan. 3. Communicate findings clearly and concisely to the attending veterinarian, providing specific details to facilitate diagnosis and treatment adjustments. 4. Collaborate with the veterinarian to develop and implement a revised behavior management plan, ensuring it is communicated effectively to the owner. This approach upholds the CVT's professional responsibility to provide high-quality patient care, act within their scope of practice, and contribute to the overall success of the treatment. It is ethically sound and professionally responsible, ensuring that decisions are made based on objective data and expert consultation. Incorrect approaches analysis. One incorrect approach involves dismissing the observed behaviors as normal without further investigation. This fails to uphold the CVT's duty of care and could lead to the exacerbation of an underlying issue, potentially causing patient suffering. Ethically, this constitutes negligence by omission. Regulatory failure occurs if this leads to a breach of standards of care expected of a CVT. Another incorrect approach is to immediately implement a new behavioral intervention without consulting the veterinarian. This oversteps the CVT's scope of practice, as significant changes to a treatment plan, even behavioral ones, typically require veterinary oversight. This could lead to inappropriate or harmful interventions, violating professional boundaries and potentially compromising patient safety. Regulatory failure would occur if the CVT's actions are deemed to be practicing veterinary medicine without a license. A third incorrect approach is to solely rely on the owner's interpretation of the behavior without independent veterinary assessment. While client communication is vital, the CVT and veterinarian possess the specialized knowledge to accurately assess animal behavior and its implications. Over-reliance on owner perception can lead to misdiagnosis or delayed appropriate treatment, impacting patient welfare. This represents a failure to exercise professional judgment and adhere to established veterinary diagnostic and treatment processes. Professional reasoning. Professionals should approach such situations by prioritizing objective observation and data collection. The decision-making process should involve 1. Recognizing and documenting deviations from baseline behavior. 2. Consulting relevant resources, medical records, veterinary guidance. 3. Communicating findings to the appropriate authority veterinarian. 4. Collaborating on a plan of action. 5. Implementing and monitoring the plan with ongoing communication. This systematic approach ensures patient welfare, adherence to professional standards, and effective teamwork. Question 7. Regulatory review indicates that a certified veterinary technician, CVT, is tasked by the attending veterinarian to feed a group of 4 dogs housed together, with the instruction to place each dog's food bowl in a different corner of the kennel to minimize competition. The CVT observes that 2 of the dogs exhibit significant submissive behaviors and avoid the food bowls when the other 2 dogs are present, even though the bowls are in separate locations. What is the most appropriate course of action for the CVT? Option A. Inform the veterinarian that the current feeding arrangement is not working and refuse to implement it until a new plan is devised. Option B. Observe the dog's feeding behavior closely, document any instances of avoidance or stress, and report these observations to the veterinarian, suggesting a potential modification to the feeding strategy to ensure all dogs have equitable access to food. Option C. Continue with the veterinarian's instructions without intervention, assuming the dogs will eventually adapt to the feeding arrangement. Option D. Immediately rearrange the feeding bowls to a single location to encourage the dominant dogs to guard one area, thereby allowing the submissive dogs to eat from the remaining bowls. The correct answer is B. Observe the dog's feeding behavior closely, document any instances of avoidance or stress, and report these observations to the veterinarian, suggesting a potential modification to the feeding strategy to ensure all dogs have equitable access to food. Explanation. Scenario analysis. This scenario presents a professional challenge for a certified veterinary technician, CVT, due to the inherent complexity of animal social structures and the potential for misinterpretation of behavior. The veterinarian's directive, while seemingly straightforward, requires the CVT to apply their knowledge of canine social dynamics to a situation with potential welfare implications for the animals. The challenge lies in balancing the veterinarian's instructions with the CVT's ethical and professional responsibility to advocate for the animal's well-being, especially when those instructions might inadvertently exacerbate stress or conflict within the group. The CVT must consider the nuances of dominance, submission, resource guarding, and individual animal personalities within the context of a confined environment. Correct approach analysis. The correct approach involves the CVT observing the dog's interactions, identifying signs of stress or potential conflict, and then communicating these observations and concerns to the veterinarian. This aligns with the CVT's role as a paraprofessional who assists the veterinarian in animal care and welfare. Specifically, it reflects the ethical guidelines that mandate veterinary professionals to prioritize animal health and welfare. By reporting observations and suggesting modifications based on their understanding of social structures, the CVT is acting as an advocate for the animals, ensuring their environment is managed in a way that minimizes stress and promotes positive social interactions, thereby supporting the veterinarian's overall treatment plan. This proactive communication is crucial for informed decision-making by the veterinarian. Incorrect approaches analysis. One incorrect approach involves blindly following the veterinarian's instructions without further observation or consideration of the dog's social dynamics. This fails to uphold the CVT's ethical obligation to advocate for animal welfare. If the feeding arrangement, as instructed, leads to increased tension or aggression, the CVT's inaction would be a dereliction of duty, potentially violating professional standards that require vigilance and reporting of adverse conditions. Another incorrect approach is to unilaterally alter the feeding arrangement without consulting the veterinarian. While the CVT may have expertise in animal behavior, the ultimate medical and management decisions rest with the veterinarian. Such an action bypasses the veterinarian's authority and could lead to unintended consequences or interfere with the veterinarian's diagnostic or therapeutic goals. This demonstrates a lack of professional collaboration and respect for the veterinary team hierarchy. A third incorrect approach is to ignore the potential social implications of the feeding arrangement, assuming the veterinarian has accounted for all factors. This demonstrates a lack of critical thinking and an abdication of the CVT's responsibility to observe and report on animal behavior and welfare. Veterinary technicians are expected to apply their knowledge to ensure the best possible care, which includes recognizing and addressing potential stressors related to social dynamics. Professional reasoning. When faced with a situation involving animal social structures and a veterinarian's directive, a CVT should employ a decision-making process that prioritizes observation, assessment, and communication. First, the CVT must thoroughly understand the veterinarian's instructions and the rationale behind them. Second, they must apply their knowledge of animal behavior and social dynamics to observe the animal's interactions, specifically looking for signs of stress, conflict, or positive engagement related to the directive. Third, if the observations suggest that the directive might negatively impact the animal's welfare or social harmony, the CVT must professionally communicate these concerns to the veterinarian, providing specific behavioral evidence. This communication should include potential alternative solutions or modifications that could mitigate negative impacts while still achieving the veterinarian's objectives. This collaborative approach ensures that animal welfare remains paramount and that decisions are based on comprehensive information. Question 8. Benchmark analysis indicates that accurate tissue identification is critical for effective veterinary diagnostics. A veterinary technician is presented with a biopsy sample exhibiting cells tightly packed together, forming sheets and glands, with a free surface and an underlying basement membrane. Based on these microscopic characteristics and their known functions, which tissue type is most likely represented, and what is its primary role in the body? Option A. Muscle tissue primarily involved in contraction and movement. Option B. Nervous tissue primarily involved in transmitting electrical signals and communication. Option C. Connective tissue primarily involved in support, binding, and transport of substances. Option D. Epithelial tissue primarily involved in covering surfaces, lining cavities, forming glands, and absorption/secretion. The correct answer is D. Epithelial tissue, primarily involved in covering surfaces, lining cavities, forming glands, and absorption/secretion. Explanation: this scenario presents a common challenge in veterinary medicine, where a technician must apply foundational biological knowledge to a practical diagnostic situation. The challenge lies in accurately identifying the tissue type based on its microscopic appearance and understanding its functional implications for the animal's health. Careful judgment is required to correlate histological features with clinical signs and potential pathologies. The correct approach represents best professional practice because it directly links the observed microscopic structure of the tissue to its known physiological function. This understanding is crucial for accurate diagnosis, treatment planning, and prognosis. For a certified veterinary technician, CVT, this level of detailed knowledge is expected and is foundational to providing competent patient care, aligning with the ethical obligation to act in the best interest of the animal and to uphold professional standards of practice as outlined by veterinary regulatory bodies. An incorrect approach that focuses solely on the gross appearance without considering the microscopic cellular arrangement and extracellular matrix would be a regulatory failure. This is because it neglects the fundamental principles of histology and histopathology, which are essential for accurate tissue identification and diagnosis. Another incorrect approach that misidentifies the primary function of a tissue type, for example, attributing contractile properties to epithelial tissue, represents a failure to meet the knowledge and competency standards required of a CVT. This could lead to misdiagnosis and inappropriate treatment, violating the duty of care owed to the patient. A third incorrect approach that relies on anecdotal evidence or non-validated diagnostic methods instead of established histological principles would also be a significant ethical and regulatory failure, as it deviates from evidence-based veterinary medicine and professional guidelines. Professional reasoning in such situations involves a systematic approach. First, carefully observe and document all available data, gross and microscopic findings. Second, recall and apply foundational knowledge of tissue types, their structures and functions. Third, correlate these findings with the patient's clinical presentation and history. And finally, consult with the supervising veterinarian to confirm the diagnosis and develop a treatment plan. This process ensures that decisions are evidence-based, ethically sound, and aligned with regulatory expectations for CVT practice. Question 9. System analysis indicates that a certified veterinary technician, CVT, is observing a canine patient admitted for routine diagnostic imaging. The dog, typically friendly and outgoing, is now exhibiting subtle signs of stress, including a slightly tucked tail, averted gaze, and a reluctance to engage with gentle petting. The CVT has also noted a slight increase in panting compared to its initial presentation. Which of the following approaches best reflects the CVT's professional responsibility in this situation? Option A. Assume the behavioral changes are temporary and will resolve on their own once the dog is back in its familiar environment, and proceed with the imaging without further comment. Option B. Document the observed behavioral changes, noting their context and duration, and communicate these findings to the veterinarian for consideration in the diagnostic and treatment plan. Option C. Focus solely on the physical examination findings and ignore the behavioral observations, as they are subjective and not directly related to the diagnostic imaging. Option D. Immediately administer a mild sedative to calm the dog before the imaging procedure, as this will make the dog more cooperative. The correct answer is B. Document the observed behavioral changes, noting their context and duration, and communicate these findings to the veterinarian for consideration in the diagnostic and treatment plan. Explanation: scenario analysis. This scenario is professionally challenging because it requires the certified veterinary technician, CVT, to interpret subtle behavioral changes in a patient and link them to an underlying physiological or environmental stressor. The CVT must balance the need for accurate diagnostic information with the patient's welfare, ensuring that diagnostic procedures do not exacerbate the stress. The challenge lies in recognizing that stress is not always overtly expressed and can manifest in various ways, impacting the reliability of observations and the patient's overall health. The CVT's role is to be an advocate for the animal, identifying potential welfare concerns and communicating them effectively to the veterinarian. Correct approach analysis. The correct approach involves a systematic observation of the patient's behavior in its current environment, looking for subtle indicators of stress such as changes in posture, vocalization, appetite, elimination habits, or interactions with handlers. This approach aligns with the ethical principles of veterinary practice, which prioritize animal welfare and minimizing suffering. Specifically, it reflects the CVT's responsibility to monitor patient well-being, recognize signs of distress, and report these findings. By documenting these observations and discussing them with the veterinarian, the CVT contributes to a comprehensive understanding of the patient's condition, enabling a more accurate diagnosis and appropriate treatment plan that addresses the root cause of the stress. This proactive approach is essential for maintaining high standards of care and upholding the professional responsibilities of a CVT. Incorrect approach is analysis. One incorrect approach involves dismissing subtle behavioral changes as normal variations or unrelated to the patient's condition. This fails to recognize the significant impact of stress on animal health and behavior, potentially leading to misdiagnoses or delayed treatment. Ethically, this approach neglects the CVT's duty to observe and report all relevant patient information that could affect their well-being. Another incorrect approach is to immediately administer sedatives or anxiolytics without a thorough behavioral assessment and veterinary consultation. While these interventions may seem like a quick fix, they can mask underlying issues and interfere with diagnostic efforts. This approach bypasses the crucial step of understanding the source of the stress, which is a core component of responsible veterinary care, and a failure to uphold the principle of do no harm by potentially over-medicating or treating symptoms rather than causes. A third incorrect approach is to focus solely on physical examination findings and disregard behavioral observations. Animal behavior is a critical diagnostic tool, and ignoring it can lead to an incomplete or inaccurate assessment. This approach fails to acknowledge the interconnectedness of physical and psychological health in animals and neglects the CVT's role in providing a holistic view of the patient. Professional reasoning. Professionals should approach situations involving potential stress in patients by first establishing a baseline of normal behavior for that individual animal. If possible, they should then conduct systematic, non-invasive observations in the patient's current environment, looking for deviations from this baseline. This includes observing posture, vocalizations, interactions, and general demeanor. Any observed changes should be meticulously documented, noting the context in which they occur. Following this, a collaborative discussion with the supervising veterinarian is paramount. This discussion should present the observed behavioral changes alongside any physical findings, allowing for a comprehensive diagnostic approach. The decision-making process should prioritize animal welfare, aiming to identify and alleviate stressors while ensuring diagnostic accuracy and therapeutic efficacy. This iterative process of observation, documentation, and communication is fundamental to providing high-quality veterinary care. Question 10. Implementation of a veterinary examination for a highly anxious and fearful Labrador Retriever presenting for a routine vaccination, where the dog exhibits tense body language, lip licking, and attempts to retreat when approached, requires a strategic approach to minimize stress and ensure safety. Which of the following approaches best aligns with the ethical and professional standards for certified veterinary technicians in the United States? Option A. Asking the owner to hold the dog down forcefully while the technician quickly administers the vaccination to minimize the dog's exposure to the stressful situation. Option B. Administering a mild sedative to the dog before entering the examination room to ensure it remains calm and compliant for the procedure. Option C. Employing a calm, quiet environment, using gentle, slow movements, offering high-value treats, and allowing the dog to approach the handler and equipment at its own pace before attempting any restraint or examination. Option D. Immediately proceeding with a firm, secure physical restraint to hold the dog still for the vaccination, as this is the most efficient way to complete the task. The correct answer is C. Employing a calm, quiet environment, using gentle, slow movements, offering high-value treats, and allowing the dog to approach the handler and equipment at its own pace before attempting any restraint or examination. Explanation. This scenario presents a common yet challenging situation for certified veterinary technicians, CVT in the United States, requiring a nuanced understanding of animal behavior, client communication, and adherence to ethical guidelines. The professional challenge lies in balancing the immediate need to provide veterinary care with the animal's welfare, ensuring the safety of all involved, and effectively educating the client. Careful judgment is required to select an approach that is both therapeutically effective and ethically sound, respecting the animal's emotional state and the client's role in the animal's care. The correct approach represents best professional practice because it prioritizes a fear-free, low-stress handling technique. This aligns with the ethical principles of veterinary medicine, which mandate minimizing animal suffering and promoting well-being. Specifically, it reflects the guidance provided by veterinary professional organizations and the general ethical framework governing veterinary technicians in the U.S., emphasizing compassionate care and the prevention of iatrogenic stress. This approach acknowledges that fear and aggression are often fear-based responses, and that addressing the underlying emotional state is crucial for successful veterinary intervention and long-term behavioral management. It also empowers the client by involving them in a positive, collaborative manner, fostering trust and improving compliance with treatment plans. An incorrect approach that relies solely on physical restraint, without considering the animal's fear or stress, is ethically problematic. It can exacerbate the animal's fear and aggression, potentially leading to injury to the animal, the veterinary team, or the owner. This approach fails to uphold the ethical obligation to minimize suffering and can be seen as a violation of the principles of humane animal handling. Furthermore, it neglects the opportunity to educate the client on recognizing and managing animal fear and aggression, which is a key component of responsible pet ownership and a service a CVT can provide. Another incorrect approach that involves sedating the animal without a thorough assessment of the situation or client consent is also professionally unacceptable. While sedation can be a valuable tool, its indiscriminate use without proper justification and client communication can be considered a failure to act in the animal's best interest. It bypasses the opportunity to explore less invasive behavioral modification techniques and may mask underlying issues. Ethically, it raises concerns about informed consent and the potential for oversedation or adverse drug reactions, which a CVT must be mindful of. The professional decision-making process for similar situations should involve a systematic assessment. First, evaluate the animal's body language to determine the level of fear and stress. Second, consider the specific veterinary procedure required and its potential to induce fear or pain. Third, assess the client's understanding and willingness to participate in a low-stress approach. Fourth, explore available low-stress handling techniques and environmental modifications. Fifth, if necessary, consider pharmacologic intervention, always with appropriate veterinary oversight and client communication. Finally, document the chosen approach and the animal's response, and provide client education on managing fear and aggression. This process ensures that care is tailored to the individual animal and adheres to ethical and professional standards. Question 11. Risk assessment procedures indicate that a hospitalized feline patient, typically vocal and interactive, is now unusually quiet, withdrawn, and has ceased grooming itself. The CVT is tasked with evaluating the animal's well-being. Which of the following approaches best reflects a comprehensive assessment of potential behavioral signs of illness or distress? Option A. Focus only on the cat's vital signs and physical examination findings, as behavioral changes are subjective and less reliable indicators of illness. Option B. Assume the cat is simply tired from its hospital stay and will resume normal behavior once it is home. Option C. Interpret the cat's quietness as contentment and its lack of grooming as a sign of relaxation. Option D. Document the observed changes in vocalization, interaction, and grooming behavior, and report these findings to the veterinarian for further evaluation. Correct answer is D. Document the observed changes in vocalization, interaction, and grooming behavior, and report these findings to the veterinarian for further evaluation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified veterinary technician, CVT, to interpret subtle behavioral changes in a patient that may indicate underlying illness or distress. The challenge lies in distinguishing normal species-specific behaviors from those that signal a deviation from health, especially when the animal cannot verbally communicate its discomfort. Accurate assessment is crucial for timely intervention and preventing the escalation of suffering. Correct approach analysis. The correct approach involves a systematic and comprehensive evaluation of the animal's behavior in its current environment, considering its history and species-typical behaviors. This aligns with the ethical and professional responsibilities of a CVT to advocate for animal welfare and provide skilled nursing care. By observing multiple behavioral indicators and correlating them with the patient's overall condition, the CVT can form a more accurate picture of the animal's well-being. This approach is supported by the general principles of veterinary medicine and the CVT's role in recognizing and reporting changes in patient status, as implicitly required by professional standards of care and the Veterinary Practice Acts that govern CVT licensure. Incorrect approaches analysis. One incorrect approach involves dismissing subtle behavioral changes as normal variations without further investigation. This fails to meet the standard of care by potentially overlooking early signs of illness or distress, which could lead to delayed diagnosis and treatment, violating the ethical obligation to prevent animal suffering. Another incorrect approach is to focus solely on overt physical symptoms and ignore behavioral cues. This is a significant failure because behavior is a primary indicator of an animal's internal state, including pain, anxiety, or illness. Relying only on physical signs can lead to a misdiagnosis or incomplete assessment, compromising patient care and potentially violating professional responsibilities to observe and report all relevant patient information. A third incorrect approach is to make assumptions about the animal's emotional state based on anthropomorphism rather than objective behavioral observation. While empathy is important, attributing human emotions without a basis in observed behavior can lead to misinterpretations and inappropriate interventions, undermining the objective assessment required for effective veterinary care. Professional reasoning. Professionals should employ a structured approach to behavioral assessment. This involves 1. Establishing a baseline of normal behavior for the individual animal and species. 2. Observing the animal in a calm and non-threatening manner, noting posture, vocalizations, activity level, and interactions with its environment. 3. Considering the context of the behavior, including recent changes in environment, routine, or medical status. 4. Documenting all observations accurately. And 5. Communicating any concerns promptly to the veterinarian. This systematic process ensures that behavioral signs are interpreted within a clinical context, leading to informed decision-making and optimal patient care. Question 12. Market research demonstrates that clients are increasingly seeking detailed explanations of their pet's health status. A veterinarian has requested a CVT to prepare a summary of findings from a diagnostic workup for a canine patient presenting with signs suggestive of urinary tract disease. The workup included a physical examination, urinalysis, and abdominal radiographs. The CVT is reviewing the results, which indicate mild proteinuria, the presence of struvite crystals in the urine sediment, and a slightly enlarged bladder on radiographs. Which of the following approaches best reflects the CVT's role in assisting the veterinarian with this case? Option A. Compile all diagnostic findings, noting any abnormalities and their potential implications, and present this comprehensive summary to the veterinarian for their interpretation and further action. Option B. Interpret the proteinuria and crystal formation as definitive evidence of a severe kidney infection and recommend immediate antibiotic therapy. Option C. Dismiss the presence of struvite crystals as a common, insignificant finding in canines and proceed with summarizing only the proteinuria and radiographic findings. Option D. Focus only on the radiographic finding of an enlarged bladder and suggest to the owner that the pet likely has a urinary obstruction requiring surgery. The correct answer is B. Interpret the proteinuria and crystal formation as definitive evidence of a severe kidney infection and recommend immediate antibiotic therapy. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in patient presentation and the need for precise diagnostic interpretation. A certified veterinary technician, CVT, must exercise sound judgment when evaluating diagnostic findings related to the urinary system, ensuring that their actions align with established veterinary protocols and ethical standards. The complexity arises from distinguishing between normal physiological variations and pathological conditions that require specific veterinary intervention. Correct approach analysis. The correct approach involves a systematic evaluation of all presented diagnostic data, correlating findings from different diagnostic modalities, e.g., physical examination, urinalysis, imaging, to form a comprehensive picture of the patient's urinary system health. This aligns with the CVT's role in assisting the veterinarian by providing accurate and relevant information. Adherence to established diagnostic algorithms and best practices, as guided by veterinary professional organizations and regulatory bodies, ensures that patient care is evidence-based and ethically sound. This approach prioritizes patient welfare and supports the veterinarian's diagnostic and treatment planning. Incorrect approaches analysis. One incorrect approach would be to focus solely on a single diagnostic finding without considering the broader clinical context. This could lead to misinterpretation of results, such as attributing a minor crystalluria finding to a significant disease process without further investigation, potentially causing unnecessary alarm or inappropriate treatment. This fails to meet the standard of care expected of a CVT, which requires a holistic assessment. Another incorrect approach would be to make definitive diagnoses or recommend specific treatments independently. The CVT's scope of practice is to assist the veterinarian, not to replace their diagnostic and therapeutic decision-making. Such actions would constitute practicing veterinary medicine without a license, a direct violation of Veterinary Practice Acts and regulations governing CVTs. A third incorrect approach would be to disregard or minimize findings that deviate from expected norms, especially if they are subtle. This could involve overlooking early signs of renal dysfunction or bladder pathology, delaying crucial diagnosis and treatment. This failure to report or act upon potentially significant findings represents a breach of professional responsibility and could have serious consequences for patient health. Professional reasoning. Professionals should approach such scenarios by first gathering all available patient information, including history, physical exam findings, and diagnostic results. They should then critically analyze each piece of data, considering its significance in relation to the patient's overall condition. Collaboration with the supervising veterinarian is paramount, ensuring that all findings are communicated clearly and that diagnostic and treatment plans are developed collaboratively. This systematic and collaborative approach ensures that patient care is both effective and ethically compliant. Question 13. System analysis indicates that a veterinary technician is presented with a patient exhibiting signs of generalized weakness and difficulty ambulating. The technician is tasked with assisting the veterinarian in diagnosing the underlying cause, which may involve the muscular system. To effectively contribute to the diagnostic process, the technician must accurately differentiate between the types of muscle tissue and their primary roles within the animal's body. Which of the following accurately describes the types of muscles and their primary functions relevant to veterinary diagnostics? Option A. Skeletal muscles are voluntary, striated, and responsible for locomotion and posture. Cardiac muscle is involuntary, striated, and responsible for pumping blood. Smooth muscle is involuntary, non-striated, and responsible for functions within internal organs. Option B. Skeletal muscles are voluntary and non-striated, responsible for pumping blood. Cardiac muscle is involuntary and striated, responsible for locomotion. Smooth muscle is involuntary and striated, responsible for maintaining posture. Option C. Skeletal muscles are involuntary and non-striated, responsible for maintaining posture. Cardiac muscle is voluntary and striated, responsible for digestion. Smooth muscle is involuntary and non-striated, responsible for locomotion. Option D. All muscles are voluntary and striated, with their primary function being movement. The correct answer is A. Skeletal muscles are voluntary, striated, and responsible for locomotion and posture. Cardiac muscle is involuntary, striated, and responsible for pumping blood. Smooth muscle is involuntary, non-striated, and responsible for functions within internal organs. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified veterinary technician, CVT, to accurately differentiate between muscle types and their primary functions in a clinical context. Misidentification can lead to incorrect treatment plans, diagnostic interpretations, and client education, potentially impacting patient outcomes and violating the standard of care expected of a CVT. The challenge lies in applying theoretical knowledge of muscle physiology to practical veterinary medicine. Correct approach analysis. The correct approach involves recognizing that skeletal muscles are voluntary, striated, and responsible for locomotion and posture. Cardiac muscle is involuntary, striated, and found exclusively in the heart, responsible for pumping blood. Smooth muscle is involuntary, non-striated, and found in the walls of internal organs, responsible for functions like digestion and blood vessel constriction. A CVT's understanding of these distinctions is fundamental to diagnosing and managing conditions affecting the musculoskeletal, cardiovascular, and gastrointestinal systems. This aligns with the ethical and professional responsibility to provide competent care based on sound scientific principles, as implicitly or explicitly required by veterinary practice acts and professional conduct guidelines for CVTs. Incorrect approaches analysis. One incorrect approach would be to broadly categorize all muscles as voluntary. This fails to acknowledge the critical involuntary nature of cardiac and smooth muscle, leading to a fundamental misunderstanding of their physiological roles and the pathologies that can affect them. This represents a failure to meet the expected standard of knowledge and competence for a CVT. Another incorrect approach would be to confuse the striation patterns, attributing striations to smooth muscle and lacking them in cardiac muscle. This demonstrates a significant gap in basic anatomical and histological knowledge, directly impacting the ability to correctly identify tissues and understand disease processes. Such a deficiency would be a violation of professional competence standards. A third incorrect approach would be to assign the primary function of locomotion to smooth muscle. Smooth muscle's role is primarily in the movement of substances within internal organs, not in voluntary movement of the body. This misattribution of function would lead to incorrect diagnostic reasoning and treatment strategies for conditions affecting the muscular system. Professional reasoning. When faced with a clinical scenario involving muscle function, a CVT should first identify the specific organ system or anatomical location involved. Then, based on that location, they should determine the type of muscle tissue present, skeletal, cardiac, or smooth. Subsequently, they should recall the characteristic properties of that muscle type, voluntary/involuntary, striated/non-striated, and its primary physiological function. This systematic approach ensures accurate diagnosis, appropriate treatment, and effective communication with veterinarians and clients, upholding professional standards and patient welfare. Question 14. Investigation of a canine patient presenting with lethargy and decreased appetite requires the certified veterinary technician to assess its physiological status. Which approach best demonstrates a comprehensive understanding of canine anatomy and physiology in identifying potential underlying issues? Option A. Focusing primarily on the dog's energy level and comparing it to how active it typically is. Option B. Performing a thorough physical examination, including auscultation of the heart and lungs, palpation of the abdomen, and assessment of mucous membrane color and capillary refill time, while correlating findings with normal physiological ranges for the species. Option C. Relying on the owner's description of the dog's behavior at home to determine the severity of the illness. Option D. Evaluating the patient's body condition score and noting any visible signs of pain or discomfort. The correct answer is D. Evaluating the patient's body condition score and noting any visible signs of pain or discomfort. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpreting subtle physiological changes in a patient, which can lead to delayed or incorrect treatment. The CVT must rely on a thorough understanding of normal anatomy and physiology to identify deviations that indicate pathology. The challenge lies in distinguishing between normal variations and signs of distress or disease, requiring a high degree of observational skill and knowledge. Correct approach analysis. The correct approach involves a systematic and comprehensive assessment of the animal's vital signs and physical condition, directly correlating observed findings with established normal physiological parameters for the species and breed. This aligns with the CVT's role in monitoring patient status, recognizing abnormalities, and communicating findings to the veterinarian. Adherence to established protocols for patient assessment and accurate documentation are fundamental ethical and professional responsibilities, ensuring continuity of care and informed decision-making by the veterinary team. This approach directly supports the CVT's duty to provide competent care and uphold the standards of the veterinary profession. Incorrect approaches analysis. An approach that focuses solely on the most obvious outward signs without considering underlying physiological mechanisms is a failure to apply comprehensive knowledge. This can lead to overlooking critical but less apparent indicators of illness, violating the duty of care. An approach that relies on anecdotal evidence or past experiences with similar-looking animals, without a current, objective assessment of the individual patient's physiology, is ethically problematic. It risks perpetuating diagnostic errors and failing to meet the specific needs of the current patient. This deviates from the principle of evidence-based practice and individualized patient care. An approach that prioritizes speed over accuracy in assessment, leading to a superficial examination, is a direct contravention of professional standards. The CVT has a responsibility to conduct thorough evaluations, and rushing this process can result in misdiagnoses or delayed interventions, potentially harming the animal. This demonstrates a lack of diligence and commitment to patient welfare. Professional reasoning. Professionals should approach patient assessment by first recalling the normal anatomical and physiological parameters for the specific species, breed, age, and sex of the animal. This forms the baseline against which all observations are compared. Next, a systematic physical examination should be performed, evaluating all body systems. Any deviation from the established normal parameters should be noted, and the potential physiological cause investigated. This information should then be clearly and accurately communicated to the supervising veterinarian, along with the CVT's professional interpretation of the findings. This structured approach ensures that all relevant information is gathered, analyzed, and communicated effectively, leading to optimal patient care. Question 15. What factors determine the extent to which a certified veterinary technician, CVT, can proceed with a comprehensive physical examination when a client expresses discomfort with certain aspects due to time constraints or perceived cost implications, while still ensuring optimal patient care? Option A. The CVT's decision to prioritize the client's immediate convenience over the thoroughness of the physical assessment. Option B. The CVT's ability to clearly communicate the medical necessity of each examination component to the client and obtain informed consent for proceeding. Option C. The CVT's adherence to a predetermined checklist of examination steps regardless of client input or patient presentation. Option D. The CVT's personal judgment regarding the client's financial capacity and the perceived urgency of the examination. The correct answer is B. The CVT's ability to clearly communicate the medical necessity of each examination component to the client and obtain informed consent for proceeding. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the certified veterinary technician, CVT, to balance the immediate need for a thorough physical examination with the client's expressed discomfort and potential financial concerns. CVT must navigate the ethical imperative to provide optimal patient care against the client's autonomy and their right to make informed decisions about their pet's health care. The pressure to complete the examination efficiently while respecting the client's wishes creates a complex decision-making environment. Correct approach analysis. The correct approach prioritizes open communication, client education, and a collaborative decision-making process. By explaining the necessity of each step of the physical examination in relation to the patient's well-being and potential diagnostic outcomes, the CVT empowers the client with information. This allows the client to make an informed decision about proceeding with the examination, respecting their autonomy while ensuring the patient's needs are addressed. This aligns with the ethical principles of veterinary practice, which emphasize client communication and informed consent, as well as the CVT's professional responsibility to advocate for the animal's health. Regulatory frameworks for veterinary technicians typically mandate clear communication and client education as fundamental aspects of patient care. Incorrect approaches analysis. One incorrect approach involves proceeding with the full physical examination without adequately addressing the client's concerns or obtaining their explicit consent for each component. This disregards the client's autonomy and can lead to a breakdown in trust. Ethically, it violates the principle of informed consent. Legally, it could be construed as practicing without full client agreement, depending on specific state regulations regarding client consent for procedures. Another incorrect approach is to abandon the examination entirely or significantly compromise its thoroughness due to the client's initial hesitation. This prioritizes client convenience over patient welfare, which is a direct contravention of the CVT's primary ethical obligation to the animal. Regulatory guidelines for veterinary technicians emphasize the importance of performing comprehensive examinations to ensure accurate diagnosis and treatment. A third incorrect approach is to dismiss the client's concerns as unfounded or to pressure them into agreeing to the examination without providing sufficient explanation. This demonstrates a lack of empathy and professional communication skills, potentially alienating the client and jeopardizing the veterinarian client-patient relationship. It fails to uphold the ethical standard of respectful interaction and can lead to misunderstandings about the value of veterinary care. Professional reasoning. Professionals should approach such situations by first actively listening to and acknowledging the client's concerns. They should then clearly and concisely explain the medical rationale behind each part of the physical examination, linking it to potential diagnostic findings and treatment options. This educational approach allows the client to understand the importance of the examination and make a truly informed decision. If the client still expresses reservations, the CVT should discuss alternative approaches or phased examinations with the veterinarian, always prioritizing the animal's welfare. This process fosters trust, ensures ethical practice, and upholds regulatory standards for patient care and client communication. Question 16. When evaluating a veterinarian's order to administer a specific analgesic medication to a geriatric feline patient with known renal insufficiency, and the prescribed dosage appears to exceed the generally accepted therapeutic range for patients with compromised kidney function, what is the most appropriate course of action for a certified veterinary technician, CVT? Option A. Administer the medication as prescribed, as the veterinarian is ultimately responsible for the treatment plan. Option B. Administer a lower dose of the medication than prescribed, assuming the veterinarian made an error in calculation. Option C. Administer a different analgesic medication that is known to be safer for renal patients without consulting the veterinarian. Option D. Seek immediate clarification from the veterinarian regarding the dosage, explaining concerns about potential nephrotoxicity due to the patient's renal insufficiency, and suggesting a dose adjustment based on pharmacokinetic principles for renally impaired patients. The correct answer is A. Administer the medication as prescribed, as the veterinarian is ultimately responsible for the treatment plan. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified veterinary technician, CVT, to balance the veterinarian's immediate request with the fundamental principles of safe and effective drug administration. The veterinarian's instruction, while seemingly straightforward, could lead to an adverse drug event if not critically assessed. The CVT must exercise independent professional judgment, recognizing that their role includes safeguarding animal welfare through responsible medication practices. This requires understanding drug pharmacokinetics and pharmacodynamics and how they relate to patient-specific factors. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing patient safety and adhering to the core principles of pharmacology and veterinary medicine. The CVT's responsibility extends beyond simply following orders. It includes ensuring the prescribed treatment is appropriate and safe for the specific patient. This involves considering the drug's mechanism of action, potential side effects, contraindications, and the patient's individual physiological status, e.g., age, organ function, concurrent conditions. By seeking clarification and proposing an alternative based on sound pharmacological reasoning, the CVT upholds their ethical and professional duty to provide competent care and prevent harm. This aligns with the overarching goal of veterinary practice to promote animal health and well-being, as implicitly or explicitly governed by veterinary practice acts and professional conduct guidelines. Incorrect approaches analysis. One incorrect approach involves administering the medication as directed without question. This fails to acknowledge the CVT's professional responsibility to critically evaluate medication orders for safety and appropriateness. It represents a failure to apply basic pharmacological principles and could lead to significant patient harm, such as overdose, toxicity, or lack of efficacy, thereby violating the duty of care owed to the animal. This approach also bypasses the opportunity to contribute to a safer treatment plan. Another incorrect approach is to refuse to administer the medication outright without providing a reasoned explanation or alternative. While the intent might be to prevent harm, this lacks the collaborative and problem-solving aspect of veterinary practice, can create unnecessary conflict, and does not demonstrate the CVT's ability to apply pharmacological knowledge to suggest a better course of action. Professionalism dictates a more constructive approach, involving communication and proposing solutions. A third incorrect approach is to administer a different medication than prescribed without consulting the veterinarian. This is a direct violation of the veterinarian's authority and the CVT's scope of practice. It introduces significant risks of drug interactions, incorrect dosing, and treatment failure, all of which are serious ethical and professional breaches. The CVT's role is to support the veterinarian's treatment plan, not to unilaterally alter it based on their own judgment without communication. Professional reasoning. Professionals should approach such situations by first understanding the prescribed treatment and the patient's condition. If any aspect of the order raises concerns based on pharmacological principles or patient status, the next step is to consult with the veterinarian. This consultation should involve clearly articulating the concern, referencing relevant pharmacological knowledge, and proposing a well-reasoned alternative or modification. This collaborative process ensures patient safety, upholds professional standards, and fosters effective teamwork within the veterinary practice. Question 17. The monitoring system demonstrates that a canine patient, admitted for a routine diagnostic procedure, is exhibiting increasing signs of anxiety and resistance when approached by veterinary staff for handling, including lip licking, yawning, and subtle tail tucking. The veterinarian has requested the CVT to prepare the dog for the procedure, which requires gentle restraint. Option A. Implement a desensitization and counter-conditioning protocol, gradually introducing the dog to the sights and sounds associated with the procedure room and restraint, pairing these stimuli with high-value treats and praise before attempting any physical handling. Option B. Ignore the subtle behavioral cues and proceed with immediate firm restraint to complete the task, assuming the dog will eventually comply. Option C. Administer a mild sedative as prescribed by the veterinarian and proceed with forceful restraint to complete the procedure quickly. Option D. Attempt to distract the dog with a loud noise or sudden movement to startle it into submission before initiating restraint. The correct answer is A. Implement a desensitization and counter-conditioning protocol, gradually introducing the dog to the sights and sounds associated with the procedure room and restraint, pairing these stimuli with high-value treats and praise before attempting any physical handling. Explanation. This scenario presents a common challenge in veterinary practice, managing a patient's behavior that may impede necessary medical care. The professional challenge lies in balancing the animal's welfare and stress levels with the need for effective treatment and diagnostic procedures. A CVT must employ techniques that are both humane and scientifically sound, adhering to established ethical guidelines and best practices for animal behavior modification. The correct approach prioritizes positive reinforcement and desensitization, which are widely recognized as the most ethical and effective methods for training and behavior modification in veterinary settings. These techniques aim to reduce fear and anxiety, making the animal more amenable to handling and procedures. This aligns with the principles of animal welfare, which are often codified in veterinary practice acts and ethical guidelines that mandate minimizing animal distress. By using these methods, the CVT not only facilitates immediate care, but also contributes to the animal's long-term well-being and reduces the likelihood of future behavioral issues. An incorrect approach that relies solely on punishment or aversive techniques would be ethically and professionally unacceptable. Such methods can inflict fear, pain, and distress, violating the core principles of animal welfare and potentially leading to aggression or other negative behavioral outcomes. This would contraindicate the CVT's duty of care and could be seen as a failure to uphold professional standards, potentially leading to disciplinary action under veterinary practice regulations that emphasize humane treatment. Another incorrect approach might involve neglecting the behavioral component and proceeding with forceful restraint without attempting to modify the animal's response. This not only increases the risk of injury to both the animal and the staff, but also fails to address the underlying cause of the resistance. It demonstrates a lack of understanding of animal behavior and a failure to employ appropriate training and modification techniques, which are integral to competent veterinary care. This could be viewed as a breach of professional responsibility to provide care in a manner that minimizes stress and harm. The professional decision-making process in such situations should involve a systematic assessment of the animal's behavior, identification of potential stressors, and the selection of appropriate, humane behavior modification techniques. This requires ongoing observation, adaptation of strategies based on the animal's response, and collaboration with the veterinarian. The CVT must always prioritize the animal's welfare and strive to create a positive, or at least neutral experience, utilizing evidence-based methods that promote trust and cooperation. Question 18. The assessment process reveals a 5-year-old intact male Labrador retriever presenting for a routine vaccination. The dog is mildly anxious but has no history of aggression. The veterinarian has requested the vaccination be administered in the examination room. Which restraint technique is most appropriate for this situation? Option A. Having 2 technicians forcefully hold the dog down while the veterinarian administers the injection. Option B. Using a muzzle and a leash to secure the dog to the examination table leg. Option C. Placing the dog in lateral recumbency on the examination table and applying firm pressure to its body. Option D. Gentle restraint with the dog standing, supported by a handler's arm around its chest and a hand gently holding the muzzle. The correct answer is D. Gentle restraint with the dog standing, supported by a handler's arm around its chest and a hand gently holding the muzzle. Explanation. This scenario presents a common challenge in veterinary practice, safely and effectively restraining an animal for a necessary procedure while minimizing stress and risk to both the animal and the veterinary team. The challenge lies in selecting the appropriate restraint technique based on species, temperament, procedure's invasiveness, and the available resources, all while adhering to established ethical guidelines and best practices for animal welfare. The correct approach prioritizes the animal's well-being and safety through a technique that is species-appropriate, minimally stressful, and allows for the procedure to be completed efficiently. This aligns with the ethical obligations of veterinary professionals to prevent unnecessary suffering and to act in the best interest of the animal. Adherence to established veterinary protocols and guidelines for animal handling, which are often implicitly or explicitly part of professional standards and may be referenced in state veterinary practice acts or board regulations, is paramount. An incorrect approach might involve using excessive force, a technique unsuitable for the species, or a method that causes undue fear or pain. Such actions could violate ethical principles of animal welfare and potentially contravene regulations concerning humane animal handling and the duty of care owed to the animal. For instance, using a technique that is known to be highly aversive for a particular species, or one that increases the risk of injury to the animal or handler without clear justification, would be professionally unacceptable. Professional decision-making in such situations requires a systematic evaluation. First, assess the animal's species, size, temperament, and any known medical conditions. Second, consider the specific procedure being performed and its requirements for access and immobility. Third, evaluate the available resources, including personnel, equipment, and the environment. Finally, select the restraint technique that best balances safety, efficacy, and animal welfare, always erring on the side of caution and minimizing stress. This involves continuous reassessment of the animal's response and adapting the technique as needed. Question 19. The assessment process reveals that a veterinarian has prescribed a topical anti-inflammatory medication for a canine patient with localized skin irritation. The CVT is preparing to administer the medication and must select the most appropriate method of administration based on the prescription and veterinary guidelines. Option A. Mix the topical medication with the patient's food to ensure systemic absorption. Option B. Administer the medication orally by syringe, ensuring the patient swallows it. Option C. Administer the medication via intramuscular injection into a large muscle group. Option D. Apply the medication directly to the affected skin area as directed by the veterinarian. The correct answer is D. Apply the medication directly to the affected skin area as directed by the veterinarian. Explanation. This scenario is professionally challenging because it requires the certified veterinary technician, CVT, to balance immediate patient needs with strict adherence to regulatory guidelines for medication administration. The CVT must possess a thorough understanding of the approved routes of administration for specific medications, potential risks associated with off-label or improper administration, and the legal implications of deviating from prescribed protocols. Accurate documentation is also paramount, as it serves as a legal record of care provided. The correct approach represents best professional practice because it prioritizes patient safety and regulatory compliance. Administering medication via the route specified by the veterinarian ensuring proper technique, and meticulously documenting the administration are all fundamental requirements for a CVT. This aligns with the ethical obligations to provide competent care and the legal mandates to follow veterinary directives and maintain accurate records, as outlined by Veterinary Practice Acts and professional guidelines. An incorrect approach, such as administering a topical medication orally without explicit veterinary instruction, represents a significant regulatory and ethical failure. This could lead to adverse drug reactions, lack of therapeutic efficacy, and potential harm to the patient. It violates the principle of administering medications only as prescribed and demonstrates a lack of understanding of pharmacokinetics and pharmacodynamics. Similarly, administering an injectable medication without proper aseptic technique or using an unapproved site could result in infection, tissue damage, or systemic complications, again failing to meet the standard of care and potentially violating regulations regarding safe medical practice. Failing to document the administration accurately or at all is a failure to maintain proper medical records, which is a legal and ethical requirement, hindering continuity of care and potentially exposing the practice to liability. Professional decision-making in such situations requires a systematic approach. First, confirm the veterinarian's orders for the specific medication, including the drug, dosage, route, frequency, and duration. Second, assess the patient's condition and suitability for the prescribed route of administration. Third, ensure all necessary equipment and supplies are available and sterile. Fourth, perform the administration using appropriate technique and aseptic principles. Fifth, observe the patient for any immediate adverse reactions. Finally, accurately and promptly document the administration in the patient's medical record, including the drug, dose, route, time, and the initials of the administering CVT. If any ambiguity exists, or if the patient's condition warrants a deviation, the CVT must consult the veterinarian before proceeding. Question 20. Quality control measures reveal that a canine patient presented with signs suggestive of reproductive system abnormalities. The CVT is tasked with performing an initial assessment, which approach best ensures accurate diagnosis and patient care, considering the potential for both male and female reproductive tract involvement in a mixed-breed patient. Option A. Conduct a thorough physical examination, including careful palpation of external genitalia, inguinal regions, and abdomen, to assess the structures of both the male and female reproductive tracts, documenting any abnormalities or variations from normal anatomy. Option B. Rely solely on the patient's vaccination and deworming records, as these often contain notes regarding previous reproductive health assessments. Option C. Immediately recommend a broad-spectrum antibiotic and anti-inflammatory treatment, as these are often effective for a range of reproductive system discomforts. Option D. Assume the abnormalities are related to the more commonly observed reproductive issues in the patient's presumed sex based on initial visual cues, and proceed with a targeted examination. The correct answer is A. Conduct a thorough physical examination, including careful palpation of external genitalia, inguinal regions, and abdomen, to assess the structures of both the male and female reproductive tracts, documenting any abnormalities or variations from normal anatomy. Explanation. This scenario presents a professional challenge because it requires the certified veterinary technician, CVT, to interpret and act upon potentially incomplete or ambiguous diagnostic information regarding a patient's reproductive health. The CVT must apply their knowledge of both male and female reproductive anatomy to assess the situation accurately and determine the most appropriate course of action, ensuring patient welfare and adherence to professional standards. Careful judgment is required to differentiate between normal anatomical variations and potential pathological conditions, and to communicate findings effectively to the supervising veterinarian. The correct approach represents best professional practice because it prioritizes a thorough and systematic assessment of the patient's reproductive anatomy. This involves meticulous physical examination, careful palpation, and potentially the use of diagnostic imaging, all guided by a strong understanding of normal anatomical structures and common variations. By documenting all findings accurately and communicating them clearly to the veterinarian, the CVT ensures that the diagnostic and treatment plan is based on comprehensive and reliable information, aligning with the ethical obligation to provide competent care and uphold the standards set by veterinary regulatory bodies. This approach minimizes the risk of misdiagnosis and ensures that the patient receives appropriate medical attention. An incorrect approach that involves making assumptions about the reproductive status without a complete physical examination is professionally unacceptable. This failure to conduct a thorough assessment violates the fundamental duty of care owed to the patient. It could lead to overlooking critical abnormalities, delaying necessary treatment, and potentially causing harm. Such an approach demonstrates a lack of diligence and a disregard for established veterinary protocols, which could result in disciplinary action from the Veterinary Licensing Board for negligence or incompetence. Another incorrect approach, such as relying solely on historical records without a current physical assessment, is also professionally unacceptable. While historical data is valuable, it does not replace the need for a current, hands-on evaluation. Reproductive anatomy can change due to disease, injury, or physiological processes. Ignoring the present physical state in favor of past information risks misinterpreting the current condition and making an inappropriate diagnosis or treatment recommendation. This failure to adapt to the current clinical picture constitutes a breach of professional responsibility and could lead to patient harm. A further incorrect approach, such as immediately recommending a specific treatment based on a partial understanding of the anatomy, is also professionally unacceptable. Treatment decisions must be based on a complete and accurate diagnosis. Jumping to conclusions without a comprehensive evaluation of the reproductive system, both male and female components as relevant to the patient's presentation, is premature and potentially harmful. It bypasses the essential diagnostic process and could lead to the administration of unnecessary or incorrect therapies, which is a violation of ethical practice and could result in regulatory sanctions. The professional reasoning process for similar situations should involve a structured approach. 1. Patient presentation and history. Understand the presenting complaint and gather relevant historical information. 2. Comprehensive physical examination. Conduct a thorough physical examination, paying close attention to the relevant anatomical systems, in this case the reproductive system. 3. Anatomical knowledge application. Utilize knowledge of normal male and female reproductive anatomy to identify deviations. 4. Diagnostic modalities. Employ appropriate diagnostic tools, palpation, auscultation, imaging to gather further information. 5. Data interpretation. Analyze all collected data in conjunction with anatomical knowledge. 6. Communication. Clearly and concisely communicate findings and concerns to the supervising veterinarian. 7. Collaborative decision-making. Participate in the development of a diagnostic and treatment plan based on a complete understanding of the case. 8. Documentation. Maintain accurate and detailed records of all findings, actions, and communications.